setting, the person-centered health home, and then I'm also going to touch a little bit on the Affordable Care Act, in particular the legislation that has authorized work around the person-centered health home. So we're going to touch on the Primary and Behavioral Health Care Integration Grant Program that SAMHSA runs, and again, the Affordable Care Act legislation. So I think that I don't need to belabor the point about why this integration is important. We know a variety of different things. We know that people with serious mental illness, that folks are dying on average at the age of 53. We know that there's a number of reasons that this is happening due to barriers to appropriate care, stigma associated with serious mental illness, lack of training around the workforce in both the primary care setting, the behavioral health setting, and I'll say that when I say behavioral health, I'm including substance use and mental health, and then just a general lack of access to primary care services. And so this lack of primary care for people with SMI has led to increased rates of hypertension, diabetes, obesity, cardiovascular disease, other health issues, and these are only made worse by some of the health practices, or unhealthy practices, I should say, that this population often engages in, which include smoking. We're very aware of the high smoking rates amongst people with serious mental illness, poor nutrition, the side effects of psychotropic medications, et cetera. So SAMHSA is really focused on how do we provide or connect people with serious mental illness to get primary care. Now, why is this direction of integration important? And what you see on the screen here is the four-quadrant model that was developed by the National Council for Community Behavioral Health Care from Kathy's organization. And I don't know if you can see it that well on the screen, but the x-axis there is looking at physical health risk and status, and then the y-axis is looking at behavioral health risk. And we know that folks with serious mental illness tend to have some pretty extreme health issues that I just outlined, and so they kind of fit into this quadrant 4, if you will, on the upper right-hand side. It has the red circle around it. But what we also know is that a lot of the research that's being done sort of in the field at large today is really focused on how do you bring behavioral health into a primary care setting. But there's not quite as much being done around how do you bring primary care into a behavioral health setting. In particular, how do you connect folks with serious mental illness with primary care. So SAMHSA, with this program, really wanted to try to address that gap, that perceived gap in the field around the knowledge that's being developed around integration. So what is PBACI? I apologize for the acronym, Primary and Behavioral Healthcare Integration. This program's purpose is really to improve the physical health status of people with serious mental illness. And the way we're doing that is by using these grant dollars to support communities to both coordinate with and integrate primary care services into their behavioral health